I see many videos on the internet that talk about kadhas and simple home cooked food. What comprises that home cooked food is important. We know that COVID is an inflammatory condition that can have lasting effects for up to months after discharge, affecting different organs. So let's look at the first point when it comes to the diet, that is calories. Now, calories must be provided depending upon whether the patient is overweight or underweight. Obese patients are more prone to pneumonia and cardiac stress. We have to ensure healthy fat loss in these patients and lean mass maintenance. Second point is about protein. Now, obviously it is indicated as top priority. We need to increase the supplementation of branched chain amino acids to up to 50% to prevent muscle loss and enhance the strength of the respiratory muscles. Whey protein is the ideal choice if the budget permits, at least for the first 2 to 3 weeks. If not, fresh curd, paneer or thoroughly cooked eggs can also be given depending upon the patient's meal preference and his digestive function. Coming to carbohydrates, now the total must not exceed about 100 to 150 grams per day. The usage of carbohydrates leads to the production of equal amount of carbon dioxide, which is called as the respiratory quotient, which must be avoided to decrease the respiratory distress. We can opt for pulses, dairy and vegetables over grains. Reduce the intake of gluten, fruits, and of course avoid fruit juices. Milk, of course, is to be avoided when the stools are loose. Coming to fat. Now, to maintain calories, the proportion of fat can be increased, giving priority to the use of medium chain and omega-3 fatty acids. Now, the omega-3 fats play a major role in immune response and they reduce inflammation. Coconut oil, butter, ghee, nuts, fish, MCT oil can be used. Olive oil, rice bran oil, groundnut oil can also be used as a cooking medium. Coming to probiotics. Now, the alteration of the healthy gut bacteria happens as a result of infection as well as treatment with antibiotics. This drives the inflammation further. Probiotic supplements help to restore the immunity. Of course, they need to be prescribed by a doctor in this case. Coming to fluids and salts. Now, fever and loose motions are associated with dehydration. Thin buttermilk, soups, coconut water, of course, unless there is a potassium restriction, salted lemon water, ORS can be used. Coming to meal frequency and consistency. Now, if the patient's dry cough and sore throat is severe, solid food intake may decrease. Therefore, warm, soft foods and supplements can be used. Small frequent feeds would be better if the appetite is less or if there is a loss of taste and smell, and the timing of fluid consumption should be in between meals. We are being forewarned of a third wave affecting children. So parents, please ensure that your kids are eating and exercising well. Finally, patients and their families may need support with their mental health as well. Seek counseling from a licensed mental health professional. We have launched a comprehensive COVID rehab plan that covers nutrition, training and mental health support. This service can be availed at home. Hope you found this information useful. Take care, stay strong and be safe.